give a full examination. And the first thing I do is get an overall. I feel the body to see what the body conditioning system is. We're a 5 out of 9, which is perfect, right in the middle of normal.
Nice.
And I just relax him so I can get started. And Otto is pretty relaxed. He's just about 6 months old. And he's here for a vaccine. I'm checking the eyes. Well, you know, from the outside, I'll be checking later with a scope. I'm checking the mouth to see if there's any tartar or any gingivitis, any redness or puffiness of the gums. And in his case, everything is perfect. And then I want to look deep inside, check the mouth cavity and the throat if I can. And then I check the front legs. I want to check for any joint problems. And of course, for any things that are, masses, any growths, check for the nails. Nails could use little nail clipping. And I even check under the paws to see if there's any foreign bodies, to see if there's any redness, any swelling. I want to look at the ears on the outside. I'll also be looking with a scope later. But just overall right now. And of course, I'm going to always check the surface to check for any bumps or lumps or sores, scabs, anything. Okay, so now I'm going to check the chest, thorax, and the abdomen. And I'm going to check deep in the abdomen and feel inside for anything that should be there or shouldn't be there. And everything feels quite nice, quite normal. And if he's too tight, I would give a little rescue remedy to relax him. In his case, he's an intact male, so of course I'm going to check his genitals. I'm going to check the back legs, his joints. In a young dog, I always check the knees very well to make sure that the patellas, the kneecaps, are in place and riding in their groove normally, because it's not uncommon for that to be wrong, for the kneecap to be out of place.
Interesting.
Get occasional lameness. Going to check under the tail, check the sacs there. And I want to check the skin. Now it's summertime, so I also want to make sure that there's no parasites. Of course, just feeling I can tell if there's ticks, but to check for fleas, you actually have to use a comb to check for it. Now in his case, the fur is a little bit matted, not really matted, but little knots, so I have to brush them out before I can use a comb. And then I'm looking for either fleas or flea dirt, and that's all negative. I don't find any sign of problems like that.
Excellent.
If I really did feel that there was concern, I'd go a little bit longer on that. Okay, so that's the general outside look. Then I want to use my scopes. So I use my stethoscope. Make sure it's not panting if you hold the mouth closed.
Sure. Okay. It's okay.
It's okay, now you can let him pant. And then I'll listen to the lungs. So I'm listening to the heart for any murmurs or arrhythmias.
Okay.
Then I want to check the eyes and the ears. Put on my glasses and look in the ears. If you hold under the chin,
Sure.
and one hand back here.
Sure. Good boy, Otto.
Oops. That's not his favorite thing.
No. It's okay. It's okay, bud. Good boy.
Check the other one. Very good.
Nice.
Very clear
Good boy.
ears.
Good job, bud.
And then I also want to check the eyes. Using the ophthalmoscope. Hi, sweetheart. Look at that gorgeous eyes.
Nice.
So he's young and everything comes out really nice. The other thing I do, which is different from other hospitals, is I check him for, actually, if you'll let go of him,
Sure.
and then I can feel his energy. And I'm checking for anything on in his spine that tingles my hands or feels warm or cold. And I don't necessarily even have to touch him. I can be a little bit above him and still feel any energy changes. And he's nice and even, so that's perfect.
Oh, good.
Okay.
Good job, bud.
So I might be recommending chiropractic or some other treatment if I did find problems. Although I do recommend chiropractic in any pet that has a backbone. All right, I'm also going to check his pulse.
Okay.
And I'm checking 12 different pulses. This is a Chinese diagnosis. And by the way, when I looked in his mouth, I was also looking at the tongue for variations in color and thickness and in scalloping of the edges of the tongue, because all of those things tell me something about his general health. I can tell heart disease from just looking at the tongue.
Wow.
All right. Any questions?